The COVID-19 pandemic threatens the progress made on TB prevention and control. Disruption of the health system can cause long-lasting impact on TB burden. In particular, resources such as medical frontliners and diagnostics have been shifted from TB control to COVID-19 response. Moreover, there has been a significant drop in reporting of TB cases, which has been observed locally and internationally. According to WHO, monthly TB notifications dropped by 50 to 75% in the Philippines due to the pandemic. Fewer patients receive and have access to adequate TB care. In fact, 1.4 million fewer people received TB care in 2020 than in 2019. The underdetection of TB cases will eventually lead to excess TB deaths. 25% reduction in TB diagnosis is projected to increase TB deaths by 26%. Another important point is the similarity between TB and COVID-19. TB and COVID-19 have similar presentations, thereby affecting diagnosis. Ultimately, the benefit of health protocols such as lockdown restrictions, social distancing, and PPEs in TB transmission are outweighed by the effect of COVID-19 pandemic on health services. For example, the economic crisis caused by the COVID-19 pandemic in our public transportation, finances, and employment also affected access to TB facilities and services. Unfortunately, the increasing TB cases will also contribute substantially to economic burden in the post-pandemic period. Because of this, the health system should ensure adequate and maintained essential health services not just for TB, but also for other health problems. Sadly, the focus on COVID-19 results in neglect of other medical conditions and vulnerable populations, worsening health inequity globally. We are now faced with a much bigger problem. This COVID-19 pandemic could trigger other medical crises because of its massive impact on health and economic systems. Now, let's compare TB with COVID-19. Patients with TB present with cough, often productive, bloody sputum, shortness of breath, fever, unexplained weight loss, night sweats, and fatigue. These symptoms usually present weeks to years if the latent TB is not treated. Meanwhile, patients with COVID-19 typically present with fever, chills, cough, loss of smell and or taste, difficulty of breathing. Other symptoms include sore throat, headaches, body aches, extreme fatigue, loss of appetite, nausea, vomiting, and diarrhea. Unlike TB, which takes weeks to years, COVID-19 symptoms take only 2 to 14 days after exposure. Although both are airborne, TB, whose pathogen is Mycobacterium tuberculosis complex, is diagnosed through a sputum test, whereas COVID-19, whose pathogen is severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, needs a nasal or throat swab. Patients with chronic respiratory diseases, including TB, are at increased risk of severe COVID-19 illness and death. In fact, TB may increase the risk of severe COVID-19 disease in children. For patients diagnosed with both TB and COVID-19, they might present with poorer treatment outcomes, especially if TB treatment is interrupted. Unfortunately, they also have lower and longer recovery rates. Moreover, the risk of TB death was higher in COVID-19 patients and higher mortality was observed in elderly patients with comorbidities. In the Philippines, the risk of death in TB patients co-infected with COVID-19 was 2.17 times higher than those without COVID-19, with a shorter time to death. TB survivors are at more risk of worse COVID-19 outcomes since their lungs are more vulnerable due to the damage from the TB infection. Faced with this new dilemma, we are now challenged to adjust how we manage our patients with TB. Currently, outpatient and community-based care is preferred over hospital-based TB treatment to reduce risks of TB transmission and contraction of COVID-19 infection. We also ask patients to continue advised TB treatment regimens at home. In order to do so, it's important that patients have adequate stocks of TB medicines at home to ensure treatment completion. In line with that, proper coordination and constant communication between TB patients, family members, and healthcare professionals is needed to monitor treatment adherence, as well as manage any adverse drug reactions and comorbidities. We also advise them to have a designated treatment partner to monitor compliance and overall health conditions. In the event that the TB patient has COVID-19 infection, TB treatment must be continued uninterrupted. Another thing we have to keep in mind is the prevention of TB transmission inside their homes. Patients have to take TB medicines as directed. They should be reminded to cover their mouths and noses when coughing. They should wear face masks. The separate room where they should be staying alone should be aired out by opening the windows if the weather allows. Lastly, having visitors in their home is not recommended. Now, certain precautions have to be done in order for TB patients to safely and effectively consult their doctors. First, they can communicate with health professionals through the use of digital health technologies such as text, call, or video observed treatment to minimize exposure to COVID-19 infection. Second, if face-to-face consultation is needed, be sure to follow the minimum health protocols such as social distancing, proper PPE, and frequent hand washing. It is said that prevention is better than cure. This is true, especially for our current situation. We must protect ourselves from COVID-19 infection. First, we have to wear masks. Use a well-fitted cloth mask or surgical mask that is FDA approved. Wear the mask properly by ensuring it covers your entire nose and mouth. Wear a mask when in public places or at home if a household member is sick. If using a cloth mask, ensure you wash it after every use. Dispose used surgical masks and avoid spraying rubbing alcohol on them. Avoid touching the outside of the mask and handle the mask by the ear loops. Second, it's important that we practice good hygiene. Wash your hands with soap and water regularly for at least 20 seconds. If you have no access to soap and water, use rubbing alcohol or alcohol-based hand sanitizer that contains at least 60% alcohol. Regularly clean surfaces and keep rooms well ventilated. Third, practice safe food and food products handling. This means avoiding unprotected contact with farm or wild animals, alive or dead, animal markets, and products that come from animals, such as uncooked meat, and ensuring that food is well cooked. Fourth, we must practice social distancing. Only go out when necessary and limit activity in public indoor places or in places with poor ventilation. Avoid crowds as much as possible and keep a distance of at least 1 meter from other people, especially those experiencing respiratory system. Fifth, we must practice proper cough etiquette. When coughing or sneezing, cover your mouth and nose using a tissue or the bend of your elbow. Move away from people. Spit only in proper places. Throw away used tissues properly. Always wash your hands or use alcohol or hand sanitizer after sneezing or coughing. Sixth, for TB patients, ensure regular intake of TB medications. And last but not the least, get vaccinated for COVID-19.